DermaHug is a fabric backed with a tacky silicone gel surface that, when stretched across an incision, increases comfort and reduces risk of dehiscence by eliminating tension on the incision. It is a tightly woven nylon and lycra fabric that is hypoallergenic, latex-free, and easily conforms to the patient's size and shape. DermaHug is available in several shapes and sizes and can be easily adjusted or left in place for 2 to 3 weeks. Because it is hydrophobic, it can be worn in the bath or shower. Hospitals achieve higher patient satisfaction scores when patients report increased incisional comfort when the ABI is in place. Hospitals also benefit from a decrease in the complication of dehisced incisions. DermaHug evolved from the ABI post-operative wound care retractor. It was developed to stabilize the panniculus above the incision after a C-section or hysterectomy, and is currently manufactured in 2 different sizes. Both DermaHug and the ABI can be easily adjusted for size and shape if needed. The purpose of applying the DermaHug is to eliminate tension on the incision or wound, which results in increased comfort and decreases the risk of dehiscence. In the case of dehisced incision or pilonidal cyst excision, wound care and dressing will be done before applying the DermaHug. First, apply the sterile dressing to the incision or wound. The DermaHug should be applied to clean, dry skin free of powder or lotions. Then, invert the DermaHug and pull the tabs off. The A and B tabs are pulled to separate the blue liner backing from the silicone gel. Attach the silicone side of the DermaHug to the skin on one side of the incision or wound, then stretch the DermaHug and adhere it to the skin on the other side. Ideally, the DermaHug should be applied with the patient standing. However, whether applied while standing or in prone position, the fabric should be taut as it transverses the incision or wound. It is adjustable, so to adjust the tension, simply lift the DermaHug from one side and stretch or loosen it before reattaching it to the other side. The arrows indicate how the DermaHug supports the incision, which results in increased comfort, decreased incision dehiscence, and expedited healing. To remove or adjust, gently peel back one side of the DermaHug toward the other side. Again, make sure the skin is clean, dry, and free of powder or lotions. Then reposition and firmly smooth the DermaHug down to the skin. Patients are immediately more comfortable wearing the DermaHug than with other devices. For example, the simple action of sitting is more relaxed when DermaHug is applied to the buttocks or abdominal area. Frequently, the first thing patients say when this device is put in place is, "It just feels better," because the incision area is more comfortable with tension decreased. DermaHug also accommodates other procedures and wounds. Here are other applications of this material. Notice how some clinicians have modified the size and shape to accommodate the different application areas. More examples of adapting the material to the wound. This patient's belly is very distended, and there is only a narrow bridge of skin holding the incision together beneath the DermaHug butterfly. It may be difficult to see, but this patient had an at-the-knee amputation in which the posterior flap incision dehisced. The DermaHug was used to help secure the flap during negative pressure therapy. Here you see an abdominal wound with the ABI modified to accommodate the tubing for negative pressure wound therapy. Where patients had to suffer discomfort and adverse reactions from tape, the DermaHug provides a comfortable alternative with no contact dermatitis. In fact, after more than 3,000 applications to date, there have been 0 reported skin issues. And if the DermaHug becomes soiled, it can be washed with soapy water, in or outside of the shower, rinsed, and air or towel dry. Tackiness will remain. Consider the impact these simple devices can have on your patient's experience. Learn more about Retentis tissue stabilizing products and DermaHug. Take the first step toward better patient outcomes and increased patient satisfaction.